Most of us have heard of plantar fasciitis. It's a fairly common diagnosis that gets assigned to someone with symptoms occurring in the bottom of the foot. Traditionally, a patient's going to report with focal pain around the front of the heel because that's where the plantar fascia attaches onto the heel bone. But my question to you is plantar fasciitis the problem, or is it a symptom? Real quick, plantar fasciitis sounds like this big thing. All it means is inflammation of the plantar fascia. And the plantar fascia is this band of fascial tissue that originates down on your heel and moves up across the bottom of your foot towards your toes. If we are having inflammation of this plantar fascia tissue, why is the plantar fascia being inflamed? Simply saying it's inflamed is kind of stating the obvious. That's like saying I have back pain and having someone tell you, well, you have back pain. It's kind of redundant. What we need to understand is why the plantar fascia is getting inflamed. One of the most common and underdiagnosed reasons for overload of any musculoskeletal structure and cause a musculoskeletal complaint is adhesion. When someone presents to our office saying that they've had a previous diagnosis of plantar fasciitis, what I'm asking myself is, okay, how much adhesion do they have in the bottom of the foot? Because I know from the patients I've worked with and what I've experienced is that if you have a lot of adhesion built up in your foot, that's going to lead to overload of the plantar fascia and therefore produce the inflammation that you're being told you have. So now instead of looking at plantar fasciitis as the problem, we can look at it as the symptom. And now let's take a moment to see what treatment of the problem, which is adhesion building up in the foot, looks like. So if you've had plantar fasciitis diagnosed before, maybe it went away and it came back, or maybe the symptoms are continuing to linger or even worsen, why don't you give us a call and see if Barefoot can help you out.